Just 1 minute, and we'll get started.
Yeah.
Good morning, Rajesh, and good morning, viewers. I know people are watching live, and I want to welcome you all in this new episode where we're going to talk about tackling the burnout, especially in the healthcare industry. And it is very good session for all the leaders who are really striving to knuckle down the burnout. That is the as we speak like unspoken topic in many of the healthcare industries. And today, Kanakraju, your host, and I'm Vice President at Donato Technologies and the founder of Fifth AI. I carry 18 plus of IT experience. And today, we're going to have this session with our guest speaker, Rajesh Venkat. It's a privilege to have you, Rajesh, on the call. And he is our guest. And he's also Senior Vice President in Commit Services, especially dealing on the operational side and revenue cycle operations in the healthcare. And they have a rich experience in dealing in this area. And I hope you all going to enjoy this session very well. So our podcast segment is divided into five types. Introduction we already done. So there are going to be three 10-minute session. We are going to discuss on core topics, and last 10 minutes going to be like key takeaways, and another 5 minutes from the viewers and the audience who are joined live. I'm just watching the live as well. If any questions in the chat, I'm going to take that up, and Rajesh going to answer, or as a group we can see how we can answer those questions. Um, so Rajesh, hope you got the segment of division right, Rajesh?
Yes, I do. I do.
Okay, thank you. And at the end, once we are done, we're going to wrap it up with conclusion statements, and from me and from Rajesh as well. That's the entire podcast segment for today, viewers. Let's with no time, we're going to start our podcast. So let me make sure that everything is on the air, recording and all of that. I think hope we are good. Um, so viewers, any questions you can type in Zoom chat or in the YouTube as well. I'll take it up. So okay, so we are going to the first segment. The first segment is talking about the burnout landscape, how the landscape of the burnout in healthcare industry. So, what does burnout look like in real operations, Rajesh?
Thanks for having me connect in first place. Um, in my words, burnout in RCM isn't dramatic, but it's quiet, creeping, and costly. What I mean by that is the backlog that keeps growing, the AR that won't budge, and the analyst who is reworking the same claim for the fourth or fifth time. In my case, for one of the clients, we provide RCM services. Over 40% of the FTE's time was consumed on repeated denials tied to medical record issues. Not because my staffs are inefficient, but only because insurance carriers' reimbursement policies are not easily accessible through a common established platform, or for that matter, a tool that boasts AI approach having solutions for all the problems.
Okay, so that's really great call out, Rajesh. Yes, sometimes we cannot really depend on systems for everything. And so, what are the root causes you see most often, Rajesh?
Yeah, there are many, but I would like to resonate on a couple of major things. One is the broken workflows, meaning lack of SOPs or non-adherence to SOPs. Then obviously your inconsistent payer feedbacks, and of course the over reliance on manual intervention. Okay, our audit team has to do a lot of audit, and what they realized and could find out was 70% of the denials, which could be avoided, originated from incomplete insurance verifications. What I mean is there are AI tools which has the capability to not only verify the insurance coverage, but also they will be able to discover the coverage even with minimal informations. But when you use, they lack the capability of showing the replacement Medicare coverages that the patient has for a specific date of service, or because we deal with a lot of labs where the specimens comes from hospitals, which means they also deal with our patients are put in skilled nursing facilities. These are expected to be available in these AI tools. Uh, but then the truth is it's either not available, or even if it is available, it is not available in the format or on the same page where it displays the results.
Okay, that makes sense. And
Yeah.
you know, as you have a rich experience in the operational side, you could able to see like end to end, the root causes from the ground level to the hospital level. So I really appreciate that. Do you see any patterns in leadership versus frontline staff?
Absolutely. But the hard truth is there is a disconnect. We as leaders emphasize more on KPIs. Like in our world, we call these terms as daily sales outstanding, the gross collection margins or net collection margins, aging buckets, and all of these. Meanwhile, the billing floor is drowning with vague rejection codes and, of course, the incremental backlogs. Our study across some of our clients showed a 45% variance between what leadership perceived as priority versus what the teams were actually dealing with. You see the
Right,
disconnect, right? I
right,
want something to be done by the team, but the moment team actually picks up the work, and they do also have to work with client demands and all that, they pick up something what they find it as priority. So there is truly a disconnect.
right. That sounds good. Yeah. So, as an additional question to the patterns in the leadership and staff that you mentioned, so
Mhm.
is there anything that we can improve in those lines? Just like a kind of like a bonus question to that previous question. Anything that we can improve?
Yes, definitely. Of course, these are rarely acknowledged, but then as an offshore team in particular, we kind of face a grind culture where burnout is worn as a badge. Uh, but then frequent pulse checks will help us to connect the frequent disconnects that we
Discounts.
come across in everyday life.
Yeah, I like the word pulse check. As
Yeah.
since you're in healthcare, always you're looking at the pulse. So
Yeah.
that's really great. And do cultural systematic blind spots play a role?
Well, like nudging back to or trying to linking back to the thing that I said. One in five team members admitted silently disengaging due to chronic stress for addressing the same claims in every AR cycle, or for waiting the customer to provide responses on exceptions that they escalate to them waiting for answers. So these are blind spots. The only way you will be able to fix these problems is definitely having frequent discussions, giving an opportunity to the team to express their concerns, than you are always trying to correct them or blame them for whatever gaps that it automatically gets created.
Got it. Yeah. That's really sometimes we oversight few of the
Yeah.
blind spots.
Yeah.
Sometimes that will really play a great role in the operations. That's true.
Yeah.
And this is general questions normally all the healthcare leaders ask. Is
Mhm.
burnout openly discussed in your organization or still a taboo?
It is definitely because it must be too. Okay. We have a platform, an internal performance platform, okay, where it tracks the burnout indicators in our dashboards. Okay. This effort is not to police someone's behavior, but we use this only to predict the risks. What I mean by that is metrics like the rework rate or the idle time. All these helps us to guide our staffs for any planning required on the floor to execute any assignments. So we don't wait for someone to break. We have built checks and balances ahead of time to really manage and tackle these burnouts.
Right. So that's right. Very true, Rajesh. So I see, over the
Mhm.
period of time, as generation evolves, handling of trust becomes like different from each generation to one generation. So, do you see any generation difference in how trust is handled?
That's a very good question. It's sensitive too. Okay, back in my era when I started my career 20 years ago, we were always in the mode of seeking. Okay, uh, but the generation now is having way too many resources or way too many sources to bank upon for solutions. Okay.
Right.
So, as leader, when you go and try to advise them or recommend a certain approach, uh, you definitely find some kind of resistance, but then you don't have much of a choice because uh, only if your customer is happy, you have work, uh, you have assignments to complete and all that. So there should be constant efforts in making the current generations realize what it actually means to be providing a customer service team.
That's true. Yeah, one type of education is very necessary, as you said,
Exactly.
and
Exactly.
hopefully, many of the participants and viewers they can pass in this video to other generations so that they
Yeah.
also get benefit out of that. I really appreciate that. So now we are going to move to the next segment, Rajesh, and the viewers.
Mhm.
This is where the crux of today's podcast. I could say that.
Mhm.
So I named it as like leadership that heals.
Mhm.
So I used healthcare term again. So the healing comes from leadership. I put it that way. So
Mhm.
now leaders more responsible on leaders. So what personal habits keep you resilient?
Very good question again. Resilience, as it resonates for me, comes from staying clear and intentional. I make it a habit to minute every conversation and track action items, whether it comes in the form of a client email or it could be just a WhatsApp message from the client. Before I wrap up the day, I make it a point, I jot down all of this. Okay. This clarity helps me to reset. Okay. Then when I go back home, I guard my sleep, start my morning with a walk. And during my drive to the office is actually when I use that quiet space to think through the workable solutions. So it's in those moments that I mentally shape the day, meaning deciding what deserves focus and what can wait. That rhythm keeps me grounded, responsive, and thereby resilient.
Understood. That's really proves that you are leading such a big company and coming out of success in the operational side. I really appreciate and I see. I mean, you walk the talk. Whatever you have that resilience that keeps the company keep moving. I appreciate that.
Yeah.
So moving on to the next question, like how do you lead large teams without burning out? This is one of the important question, I think. Yeah.
Yeah, we are connecting back to the topic. Okay, I believe resilience in leadership comes from decentralizing control while doubling down on context. Okay, at
Yes.
commit services, we don't run one big team, although we are 350 people sitting in one common place. Okay, we operate specialized center of excellences. What I mean by that is whether it is a billing team, coding team, or AR recovery team, they are structured by process. Then within each function, we align people based on their expertise, whether it's labeling or people providing or the team providing services or solutions to a assisted living center or ASCs or behavioral health practices that we manage. Okay, we even have a dedicated group focused purely on contract negotiation, yeah, powered by our reimbursement analytics, which we could develop over a period of time. So everyone owns a piece of the puzzle, you know. We review goals and workloads every week and make adjustments quickly if needed. If any unit's workload crosses 80% for 2 straight weeks, we try to rebalance early. Okay, that's how we prevent fatigue from turning into a failure.
Very true. Very true. I like that approach of decentralization of the decisions to the lower levels, which really helps not to get too much burnout. Sometimes leaders, and both levels burn out different ways, and
Yeah.
teams especially, holding on to certain decisions, until leadership comes and shares. They
Mhm.
kind of like they're kind of stuck, in a way. So that's great, Rajesh. Have you seen empathy transform outcomes, like that you mentioned, checking the pulse out or something? You care about team.
Mhm.
Have you seen empathy transform the outcome? Yeah.
Definitely connect. I've seen how just taking the time to listen can completely shift outcomes. We had a billing team that was falling behind for a few weeks to cope up with the client's demand. So instead of piling on more pressure, I sat down with them one on one to understand what was really causing the dip. Okay. Happened to realize they were stretched across too many non-core tasks. Okay. So we rebalanced the workload, gave them space to refocus, and thereby recognized a great level of progress. Okay. Within just a couple of weeks, their overturn rate jumped from 70% to 90%. So you realize the power of empathy here, right? It's not about being soft, but then it's about unlocking performances through trust and the support.
Yeah, that's really a transparent transformation. I call it as like transparent. You see the outcome.
Yeah,
Once we
yeah,
care about the team and listen to them, and really the transformation has been seen in the team, very transparent, and it's huge impact as well. In a way, both ways. We call it as return of investment, in business terms, but really, transforming each and every team member really helps them to grow and also work for their organizational growth. Both ways it works, two sides of the
yeah.
coin.
Two sides of the coin. Yes.
Yeah, thank you. And in the segment, one of the bonus question I would like to ask, since we are to keep viewers busy thinking and also to really make more kind of activeness in the session. What's one leadership myth you would love to bust in healthcare?
That's a very good question again. As strong leaders, we have to be solo decision makers. Okay. So the truth is, best leaders are signal amplifiers. They have to be listening loud than they speak. and they have to act before the system stalls. So listening sh- basically should be helping you to make those decisions. So that's the
Understood.
myth.
Okay. Got it. So with that bonus question, I really appreciate. You want to take just 2 minute water break or something, Rajesh?
Yeah, I would
To
appreciate.
Okay, okay. We'll just take 2 minutes water break and come back and join with us. We have Rajesh. So far we shared a lot of this very good discussions. Keep on active in the live. Viewers will just break for 2 minutes and come back and continue the third segment and fourth and fifth. We'll see in just 2 minutes, Rajesh.
Thank you.
Hi, Rajesh. Welcome back. Hope the water break really helped. So,
Yeah, kind
yeah,
of help to rewire.
yeah, yes. Uh, I would say that breakouts in burnout are really needed. so, so breaks in burnout is really needed. So we're moving to the third segment of our podcast today. So the topic is it's a burden or blessing. The technology is a burden or blessing. So as you know that technology transformed business definitely and helps humanity in such a way that the engineering intuition a lot of things that really transforms humanity. So what tools truly reduce burnout?
Well, tools that disappear into the workflow. Okay, for example, so our software, Commit MD, does real-time eligibility engine, which cuts the manual verification by about 80%. Okay, that's our efficiency results our team is able to calibrate. So 80% means it's not just time saved, rather it is a cognitive energy preserved. So teams now focus. So the advantage what it gives is when 80% of your repetitive tasks are managed by automation, The team has the liberty of focusing on exceptional cases and not the redundancies anymore.
Understood. The second follow-up question with that is like, do you feel the return of investment of tech truly reflects the user experience?
Uh, well, it's a good question, but not unless you measure it. So, as a tech company and a services company, we don't just track automation rates. Rather, we track how many tasks are reopened or even corrected or even escalated, because the true ROI lies in the cycle completion, not based on speed of solutioning, right? Especially in our part of the world, regardless of whatever you do, whatever you project on the calls, explain on the calls, they're going to look at whether the claim, the service that is provided, the claim that is submitted turned into reimbursement or revenue. Okay. If that doesn't happen, no matter whatever you do, is like efforts going in vain. So, my response is like you have to be tracking the efficiency by in terms of tasks that are not getting reopened, rather getting corrected.
Understood. That's true. And anytime that you experience the technology makes things worse. I know we discussed, previously in our previous conversations. I heard a very interesting, fact about it. And why can't you share more about to our viewers today?
Yes, definitely. Okay. What happens is if tech doesn't capture the nuance, it can definitely make things worse. For example, I have an instance where, for one of the clients, we deployed a scrubber, okay, which can identify the repetitive errors, but then it did not work, especially to recognize the modifier pairing that it has to go with the CPT. Uh, because it failed, denial rates went up to 20% higher than it was. So it was a wake up call. Okay, bad tech is actively harmful, and it only gets worse with frequent changes. Okay, because now with payer policies are very frequently changing,
Right.
but it is not available easily in any of the reputed platforms offered by the payers like Avality or even Optum. So tech can go worse if it cannot pick the nuance.
Understood. Yeah, makes sense. Because, as you said, the policies between different states and different providers,
Yeah,
it differs. So that
yeah.
that makes sense. And how do you protect the human side when scaling technology?
You definitely have to build overriding logic and human approvals, and definitely explainability into every loop. Okay. So in our platform, Commit MD, we have this provision where executives or a coder can contest an AI flow, and they can also be able to add notes and documentation which supports. So what we trust is people over protocols, because good tech supports decisions, but it should not and it doesn't dictate them.
Understood. So I want to chime in a little bit here. Really,
Mhm.
yes, I understand. Even next question, I'm going to talk about AI. So, as from Dundra Technologies and also from Fifth AI, we already, discussed many times in various forums. The
Mhm.
artificial intelligence itself not sufficient to process things or to really, automate certain
Mhm.
repetitive tasks.
Mhm.
It also slowly coming to the human life in such a way
Mhm.
that it's sometimes the judgment decisions also need to be taken by AI.
Yeah.
They call it AI insights.
Mhm.
How we are really, dealing with those things, right? So that's what I stand is like, our ethical values should be really, fabric with human intelligence, and also the divine intelligence that I was talking about in many forums, like, higher standard knowledge always is a standard. So we will not go into the bias situations, and that's how, in fifth AI we've taken cautious decision, and
Mhm.
implementing the bias threshold in our algorithms, and in
Mhm.
our process as well, where, really, saving the human side, as I was talking about. It's not saving; it's kind of like preserving the values, the ethical values, and yeah, which AI should not take over, and make wrong decisions. And that's why, we said it's a burden or a blessing. Technology, in the nowadays in the AI world, how we are going to tackle that very, very, I should say responsible. That's what I say, responsible AI. So everyone has to embrace that.
Yeah.
And certainly, at one point of time, someone has to come and take a stand. Hey, we need to follow this. So
Correct.
that way, we could give a direction to the next generation.
Correct.
And in the third segment, one last question I would like to emphasize is, if we could redesign one workflow using artificial intelligence, what it would be and why?
Well, definitely appeals, hands down. Okay. I would like to have pre-filled templates matching the payer requirements, linked with documentations which is available in the payer portals to tackle all the repeated denial patterns. Okay. In fact, as an effort towards that, we have aligned our experts spend majority of their business hours coming up with ready-made templates that can be loaded into our platform. So that transformation, I can say, is definitely in motion. So appeals have to get more optimized because the denial patterns are common, repeated, which I always reiterated in this conversation. So if we can come up with denial, like appeal reasoning, backing up with the payer policies and the actual service provided, it is definitely going to be a blessing for all the RCM companies and all the leaders involved in RCM companies.
That's true. Um, yeah, that's what I was mentioning. Like, even fifth AI stands out. How we need to really think through that layer of segmentation with different repetitive tasks. And
Mhm.
it's not about automation. It's kind of like, more intuitive, design that
Yeah.
really, AI, artificial intelligence, is not only part of like repetitive task automation, but it is more than that. We can say that we discussed about a lot of patterns,
Yeah.
in our, burnouts, and how it transforms the outcomes. So all of that, we see a great, opportunity there. Like AI and machine learning, those two are go together in terms of
Yeah.
technology. And yeah, that's what I was thinking. Like, it's a great insight, Rajesh. Thank you for sharing. And I
Yeah.
know this podcast really, going to impact at least few target audience, especially in the revenue cycle and general burnouts, how to handle that. And so when viewers see that, and we want to really give them one thing that all healthcare leaders should start working from tomorrow. So what do you do? What one thing that leaders can start doing tomorrow?
Yeah. Very insightful. Okay. Uh, One that very thing I would suggest RCM leaders start doing tomorrow from tomorrow is step back and ask your team what's that one thing in your day that slows you down but adds no real value. Okay. Maybe these are small repetitive tasks chasing missing documentation, updating the trackers manually, or following up on the same denial again and again. But as leaders, we are constantly pulled into client calls, explaining the forecast gaps or defending the collection trends. But if we don't fix what's dragging our teams down at the ground level, those calls are never going to start. Okay. So, on that note, we made an effort in understanding what are those two or three recurring tasks across our billing team or AR teams, and we could eliminate them through our minor workflow tweaks and tech enablement. Okay. The result is each team member could at least reclaim a valuable amount of time over a period. That space allowed them to focus on tougher denials and client escalations. And it really gave us clear visibility when responding to performance related questions. So it wasn't just a time saving exercise, rather, it was a shift towards more meaningful and result driven work.
Understood.
Yeah.
That was so insightful, Rajesh.
Yeah.
Um,
Ask
I
being
I'll
deep all the time.
I'll recap that. All the
Yeah.
leaders should start groundwork now. That's what I I want to say
Yes.
that. So they
Yes.
have
Yes.
to, yeah, they should all need to work on the ground. So that makes sense, like, connecting, the ground realities to the top level, and leaders
Yeah.
should know about that. And same way, ground, ground level, or I can say that, the crux of the organization is the resource and team, right? So they should
Yeah.
know what's happening on the top level.
Yeah.
So in spite of all these things, right,
Mhm.
taking the pulse from the team, as a leader, I feel sometimes people do things very, very quietly or silently. We cannot call them as introverts, but sometimes I name it as like silent strugglers. So
Yeah.
um, how do you support the silent strugglers?
Okay. Maybe even I was part of the group until the, what I am today. Okay. So this was always the calling. Okay. One of the effort is definitely start by making it easy for the people to speak up without making it a big deal. Uh, we have to use simple anonymous check-ins each week. Just a few questions to see how people are really doing. But we don't just rely on self-reporting all the time. We also have to watch for patterns like the sudden drop-offs in logins, missed stand-ups, or unusual idle time by any of the team members. These are quiet signals help us spot when someone might be struggling, even if they haven't said it out loud. So what it helps us is checking in directly, but not to pressure them, but only to support them. The goal really is to stay ahead of burnout before it shows up in the performance.
Okay, got it. Yeah, that will really helps them to know they're not recognized. Sometimes the other side of thing is silent strugglers feel that they didn't recognized by higher levels, and
Yeah,
that assures that when we talk to them, and it makes them like feel like recognized, and yeah,
you have to
keep
give
doing
them the
what they're doing.
space to be heard.
Yes, yes. Yeah, true
Yeah,
hard work should be rewarded. That's what we feel like as
exactly.
leaders. And
Exactly.
yeah, so uh, we are coming at to the bottom of our podcast segment. So I already told viewers to post questions in the chat. I'm waiting to see that. And let me check back if any questions in the chat in the live. Um, Currently people are watching in the online. Thank you for all joining. And if you have any questions for Rajesh, please free to put it in the chat, either in the Zoom or in the YouTube live chat. I would like to see those questions. Okay, one second. Meanwhile, I'll take up the questions. One of the common questions that people ask is like, um, you know, as business is really transforming every day now in US and various countries,
Mhm.
what is the hope that um, I mean, what gives you hope in healthcare industry today?
Okay. I have knowledge only towards US healthcare. That has been my bread and butter passion, the space that I can look up to and all that. So, the piece of advice is definitely to all the ops leads or practice managers or lab owners. What I would like to tell is RCM doesn't have to feel like a survival. It can be strategic and it can be human and it can scale too if the systems are built right. Otherwise, yes, you have to be going through the tedious process of burnouts or constantly taking the calls from the customer, talking about the escalations and all that.
Right.
So, as human as possible, and use the automation as a support to enhance the human output. So that's the hope.
Okay, great. And I'm going to ask one tricky question with kind of like, when we finish the meal, definitely we have a dessert. So likewise, we are going to wrap up with this nice question. So what's one principle you will never compromise on, even if it costs you success?
You're wearing the shoes of your associate, although you are in a C suit in terms of the org structure. Never forget that resilience and persistence in learning had helped you to come all along the way. So stay persistent.
Okay, good. That's good. Don't never lose your identity or your
Yeah,
things. Yeah, that really makes a good wrap up and a good dessert in the podcast.
yeah.
So um, now let me look at the questions that viewers posted, and let me ask one of the questions. One second. I think someone asking. Let me ask them like. Hello, viewers. If you have any questions, you can post there, um, so that we can answer that. Okay. So if not, we can take up in further future podcast sessions as well. I'll gather those questions and we can prepare and continue the podcast. I really appreciate Rajesh for this time, and the viewers also who are watching online. I know you're trying to post questions, but I couldn't able to get those. If you could put it in the chat, Zoom chat, or in the YouTube chat, it's really appreciate. Yeah. So one question that came in is like, okay, I got one question. So as many prefer AI agents over doctors for support, will AI replace doctors or how can both work together? That's the question from the viewers.
Yeah, that's a very good question. Think, all through my conversation, I have been reiterating. I never want to see AI taking over human, because AI came up because a human was trying to reduce the repetitive tasks. When such is the objective that we are running our organization, and that is the kind of the model that we offer to our customers, being in operations, if that is the case, then for a doctor who is considered to be equal to God, he or she should never be replaced by an AI, but rather, yes, to have the opportunity to provide healthcare to the growing needy population. AI should definitely come in as a supporting system,
Okay.
not definitely taking over the doctor's position itself.
Okay. Yeah. Hope that answers your question, Kavya. And another viewer, Karthik, he was like asking question: what is the one
Mhm.
human value or principle that AI must learn to truly serve and care for patients, not just treat diseases, but to heal people?
Yeah, connect with people, try to understand the need. Don't make it more software oriented, rather understand the feel of the question, feel of the need, which I don't know. I'm not sure if AI will be able to do it. Yeah. But then once again, AI is also developed by humans. It could be a possibility, but but at least as of now, it sounds too ambitious.
Yes, that's a good question, Karthik. Hope Rajesh answered the question. So, yeah, like AI has to be always, updated with data. That's what I feel like. Just to add on to Ajish, not to
Yeah, yeah, I agree.
yeah, override his thoughts, but just to add on. Always, as you all know that AI is just trained on a data and a model, right? So as data in, good data in, good data will come out, right? So we have to really train the AI how it should behave, because that input will help AI to learn, and then over the period of time it will train by itself. So that's
Yeah,
we call it training the model, and how it should serve the patients, not just diseases, right? So obviously, you're right, Karthik. AI will always diagnose the disease, diagnose the patterns, and diagnose the patient's vitalities, vital signs, but it cannot heal. Doctors has to really treat, and it has to be healed. Of course, we all believe that divine healing is the ultimate, and more healthcare believe that COVID proved that divine intelligence and divine healing is the ultimate. So yeah, and the last question, since we are almost end of things, one of the viewers, they posted me, they couldn't able to post in the YouTube, they texted me.
Mhm.
So how is AI is going to help in senior health?
How is AI going to help
Help in seniors health.
seniors' health? Okay, that's a very good question. Well, if not, the diagnosis are related to some chronic diseases. What seniors lack is the emotional connect. I could see a lot of apps which helps you to connect with people. So if these apps are able to connect seniors to seniors to disconnect, I'm sorry, connect. I think that's the one area that I'm personally desirous to heal their mental problems, if not the chronic diseases.
Okay. viewers hope that answers all the questions. And okay, Karthik, just a follow up question. Probably I'll take this Rajesh, with your permission. Can I take one question and
Of course.
we'll wind up?
Yeah. I think
So
we still have five
what
minutes.
Karthik asking is AI can
Mhm.
diagnose faster, predict outcomes more accurately, and never get tired. What role do you believe humans should still play in the future of medicine?
Well, the future of medicine should be in the direction of preventing the diseases than allowing it to happen, because there are enough and more clinical evidences um, that helps you to understand what human has to go through. One such example is definitely COVID. Just some preventive step, like getting vaccinated for the kinds of viruses that one have to take and all that, could have easily prevented it to happen, to have an epidemic situation. So work more on evidences that you get through any researches, and try to see if there are easily available preventable solutions, than trying to let it diagnose severe and go to the doctor for a severe fix.
Right. Um, Thank you, Rajesh. Just to add on, Karthik. So as I mentioned, right, AI will only perform better if you have more data samples. Otherwise, it will give wrong perception and wrong answers. So we need to really have huge data patterns or data sets to make it AI more effective. Recent studies, and hope everyone will learn in machine learning courses as well. So if a MRI scanning, the position of the scanning has been little tilted, because various hospitals capture the MRI in different ways. um, you know, or X-rays or whatever the reports, they capture different formats and different dimensions. So AI should able to understand those dimensions and patterns, then only can able to diagnose. So all these areas, human intervention is very much needed. Even though by seeing the X-ray scanning, if or MRI scanning, AI predicts some good insights. Still, it has to be vetted with a good physician or provider to get the opinions, right? So obviously, there should be a human intervention to judge whether the system is working perfectly fine or not. So that really, um, plays important role. That's interesting. But if AI continues to outperform in precision speed, do you think patients still trust human instincts over machine intelligence, or will the definition of a good doctor? Okay, so as Rajesh mentioned previously, machines cannot replace doctors. So hope that answers. Yeah, I mean, even I could say that my mentors and all of that I could able to relate the answers now. So AI doesn't have soul. It only have you know you know the little brain of human. It doesn't have soul. Definitely it cannot really become a real human. It just kind of like enhance humanity, not replace the entire human. So I think we have 5 minutes to go. So we're going to last conclusion segment, Rajesh. So where can people connect with you to ask further questions, or like they want to connect with you? Could you put a little bit share about your company? I know you passed me one brochure. I'm going to
Yeah.
post in the chat, in the YouTube chat as well. Viewers can grab that. Yeah. Apart from that, you could share where people can connect with you.
Well, I'm definitely very active in LinkedIn, which many of the professionals follow. And then we also ensure weekly articles are posted, and surveys are posted for people to really engage with us. So if there is one platform where we can be actively found is definitely LinkedIn. And of course, the moment you type Rajesh Venkat Commit Services, I'll be listed at the top. Please feel free to connect me through LinkedIn. And I'm someone who is always good in responding, being very interactive on the social media platforms, especially in LinkedIn. So that's where I can be found, and that's where you can learn more about Commit Services as an organization.
Right. So I'm pasting the brochure, PDF brochure as well in the YouTube channel. Please grab there if at all you would like to have that one. And there are no questions from the viewers. And with one statement, I would like to wind up today's session. When it comes to AI, um, technology without ethics, it's just power without purpose. I will repeat again. Technology without ethics is just power without purpose. So let us build missions that serve humanity, not replace its soul. With that wrapping note, I would like to conclude today's podcast session. Thank you, viewers, for joining. Hope you listened very well, and thank you for your very valuable, insightful questions. And thank you, Rajesh, for patiently answering that and adding, more values to the community. And we'll continue this podcast based on the next topic. Viewers suggested, few, and I can also go through and we'll come back again for next episode. Until then, we all can connect to the next session, viewers. Thank you all for joining. Thank you, Venkat, so much. We'll join in another session. Thank you all.
Yeah. Thank you so much, Kanak, and thank you so much to all the viewers. Although it is my first of its kind of experience, but I think and somewhere believe I could respond to the questions true from my heart. Okay.
Yes. Thank
Thank
you,
you once
Rajesh.
again.
And as Rajesh mentioned, you can follow up in LinkedIn. He has around 30 to 40,000 followers, I think. So please follow in LinkedIn. Thank you all.
Thank you, everyone.
Thank you. I'm stopping.